The Ron G Morning Show, every Monday through Friday at 7 a.m. only on WSAN Radio, the soul of America. All right, good morning, everybody. We still got Dr. Wright. She'll be joining us in a few seconds. But we are here. Let me go ahead and get everything set up and going right on time.
There she goes.
There we go. All right. There she is. Good morning, everybody. Good morning. I got Dr. Wright on here along with, is it Angie?
Yes, Angie
Angie.
Garza.
Angie is on. I met Angie when I came out there one time and visited the facilities out there, and she was sitting back over there. She was not in a corner, but she was far enough away from everybody where she could do her thing without nobody messing with her. Is that a good way of saying that?
Yes.
She's busy. Don't come mess with her. But anyway, I am honored to have y'all on the show this morning because I ran across Dr. Wright at a clinic that was opened up on the south side. And she said, I haven't forgot about you, Ron. I was not worried about it and everything. And then she reached out to me and said, hey, I need to come on and talk about a program she got coming up. And, you discussed this with me a while back, but now reality done set in, Dr. Wright, and it's actually moving and grooving.
It is.
Uh, so both y'all introduce yourself first before we get started so all the listeners know who you are.
All
Go
righty.
ahead.
Good morning, everyone. My name is Dr. Gloria Wright. I'm a psychiatric nurse practitioner by profession. I am fortunate to be with Pinnacle Career Center today. So I will let Miss Angie take it on from there.
Good morning, listeners. My name is Angie Garza. I'm a registered nurse, mastered in nursing education, and right now I'm the director for Pinnacle Career Center, which is a brand new school that, to the vision of Dr. Wright, wanted to put something out in the community to train future healthcare providers to be the best and most efficient. And so that has come to fruition. I'm very excited about this program and this school. We have many more programs that we're setting up for alignment to get started. But I'm happy to say that we just recently, last Monday, graduated our first cohort of certified nursing students. Yay!
Wow.
And as of yesterday, we have a 100% employment rate.
Ooh, outstanding. I like hearing that. So,
Yes.
let me ask you something. What inspired you to create a support this summer for the CNA program?
So we know that summer's coming. School is already, the high schoolers are coming at the end of their school year, and summertime, sometimes they want to do something, but they're not really sure, or somebody that's interested in healthcare. So we're providing a special discount for our program for these particular groups of students, potential students that want to get into healthcare. It's the quickest way to get in. It's only a 4-week program. So they'll be in and out before the summer's even over. So they'll still have time to, do some fun things over the summer, but also get their foot in. The serious ones that are just about to graduate, start their careers in a healthcare environment. So that's what Dr. Wright wanted to put together this particular special. We do have a class starting on May the 11th, and that class is mostly geared for that particular event that we're trying to get started for the summer.
That is a critical need here right now. Besides mental health, and then nursing is right below that. There's a critical need out there, and kids do not want to go to a 4-year college.
Correct.
Because they feel that's taking their time. I talked to some high school students the other day. They have no clue what they want to do once they get out of school. And one of them said it's not college because it's too expensive.
Mm.
So this is a career that we're looking at right now. You're going for. So my next question, who is this program designed for?
It's really designed, the program itself is designed for anybody that either has been interested in healthcare, they're maybe working another job, or they're retiring. I've had retirees come in, second, third careers in their lives. It's just really anybody that wants to give back, to humanity and their fellow, citizens, and who's just interested in helping. But we are mostly geared for, you have to be a high school graduate at least. There's some requirements that if they go to our website, which is www.pinnaclecareercenter.com, it has all the information, and it also lists the programs that we're really excited about that we're coming on board. Our next one is going to be medication aid. So that's another exciting need here in the community. I work somewhere on the weekend as a supervisor, and they are so invaluable, the medication aids, to the nurses being able to do their other duties. So we're excited about that program. But really, to answer your question, it's anybody that wants to put their foot in healthcare in a short amount of time and, just start helping, But so that's really about it. As far as what they'll make, at minimum coming out, our minimum wage is what, 7.25 right now, I think, an hour.
Yes.
But they will actually CNA start at almost double that, if not more. So that's another kind of leading point of like you're going to get this short-term career, but you're going to be making almost double minimum wage, which is what young people are interested about. What are they going to be earning for their time?
Hmm. That's so important. So important.
Right.
So, um, with them getting into that course, what skill will a student need to learn in the course?
So we teach our course is a little bit more intensive than a typical CNA course where they just teach them how to bathe them, feed them, dress them, move them. My program, I've set it up to pique their interest into going further into healthcare, meaning like a nursing career. So I teach, they learn basic patient care, head to toe care, meaning feeding them, dressing them, bathing them, of course, changing them. Their environment, their bed and their environment, keeping it clean and safe. But they also learn about anatomy and physiology, some signs and symptoms of the most popular diseases, unfortunately, in San Antonio are diabetes, congestive heart failure, COPD, and stroke. So my program teaches them to recognize some of the signs and symptoms of those disease processes while they're out on the floor so that they can immediately get help for that patient, to call the nurse and say, hey, this is going on with this patient. These symptoms are going on. And I call it a cluster of three. If you see three things going on, you need to go get your nurse immediately, not wait till the end of the day to report it. So it's kind of critical thinking is a skill that we teach. I tell people we all know how to critically think. We just don't realize that we're doing it
Yeah.
by what we decide of when we get paid, what's due, what's more important. That's critical thinking. And that's something that we teach in this program as far as it applies to healthcare and the patients that they're going to be responsible for. So that's kind of what we're teaching them how to be a responsibility, advocate, and, just be accountable.
No, I like what you said, knowing the signs. There's everyday people walking past people that don't notice the signs. I was watching a program one time, and this individual, it was a newscast, had a stroke on the air.
Wow.
And people noticed that sign right away and cut to commercial. And later on, he made it, but somebody in the studio recognized the sign.
Right.
And so, how can it be? I know it's a loaded question I'm going to ask you, but should everyday people know the signs of what's going on, even around total strangers?
It's something that would be great, that if everyday people would, but people are so, you can walk by people every day and not even pay attention. If you ask somebody that you walk by, what were they wearing? You're like, what? Because they're not that attentive to what they're doing. But healthcare people, we're watchers. Like I'm a nurse. I watch even in the grocery store. I'm watching as I'm shopping and just keeping my eye open. Gloria's laughing because we do, and I've been known to go up to people and say, hey, you might want to go talk to your doctor about, it's just my nature. I'm just nosy and curious. But healthcare individuals are, we are that. We are watchers. But I do agree with you that it would be really great if the general population had some kind of just basic training. They don't have to know the ins and outs of what's happening at the cellular level or what's happening at this, but just some
Right.
basic science to watch your fellow man. Like, hey, that person doesn't look quite right. Maybe X, Y, and Z is going on. But it doesn't happen. But yes, I wish that our world was a little bit more open to that. But people are like, I don't have time to learn that. I've got my own job, my own business going on. And it's unfortunate. But yes, you do have a great idea that it would be great to learn just basic signs of things to be able to lend a hand when an emergency is happening.
Yeah.
And if I
Yeah.
may piggyback off of that, because you have to keep in mind, identifying those symptoms, they shouldn't be rocket science, right? They shouldn't be something that Oh, I didn't go to school for that. No. We at Pinnacle Career Center also offer CPR training, BSL, which is something that is just a basic life-saving skills, right? And BLS. So we say, come on, we not, even if you're not looking to do the whole 4 weeks course and to understand, hey, what does it take to care for someone and all the other process, you can simply come on just to do your BLS or the CPR training. And we either come to office, if it's a group setting, we come to the location, or if you want to bring the group to our campus to do the training as well. So if be it for the CNA or the CPR, BLS, we have all of those trainings that we can provide, and that one is but a few hours a day, and then you're done, and you have your certificate, and you can identify the symptoms. Just wanting to share that as well.
You know, I'm gonna share a story with y'all. About 15 years ago, I was at a restaurant. I was eating. I just ate. I was feeling fine. Then all of a sudden, I just felt lightheaded for some reason. I didn't know what was going on. I told my wife I didn't feel good, and and I did not know it. But at the time, there was two nurses sitting behind us in the booth, and all of a sudden, I fainted. And before I hit the ground, somebody jumped across the table and grabbed me. The nurses said they seen some signs of what was going on with me. And I'm a type 2 diabetic. I took my medicine. I did everything I was supposed to. I did everything by the book. But my sugar level just bottomed out for no reason. We found out why. But at that time, the two nurses flew across over there and went into action. And when I finally woke up, there was a glass of orange juice right there for me. Everything was right there. I did not remember anything falling out. But I remember those nurses, and I thanked them because they seen something that nobody else seen. You know, so that's
Yeah.
why I could contest to that. That yes, you could see signs, and they didn't know who I was. They were just total stranger. They just jumped into action. And you know, and I appreciate that them doing that. But after that, I got my checkup and found out the medication I was getting was of the dosage was too much. No matter what I ate, my sugar level just bottomed out. So
Mhm.
I adjusted that. And I haven't had that problem anymore. So,
Good,
but
good.
yes, what you say about knowing the symptoms and seeing what's going on is part of the problem. And like you said, Angie, part of the problem is people do not want to get involved anymore. They're so scared to be sued. They're so scared of retaliation. Like there was a time when somebody helped somebody and with CPR and cracked a rib doing it. They want to sue the person for cracking the rib, but yet the person lived. Where is
Yeah.
common sense anymore?
Well, the good thing about that now is I'm assuming because sues happen wanted to happen so often is we have what's called a Good Samaritan law. And as long as you're not doing something that's beyond your scope of practice, like every practice has rules and regulations, right? And the different levels of nursing have scope of practice. Like I'm an RN, yes, but I'm not an advanced practice nurse like Dr. Wright. So my scope of practice is limited to my RN master's, where hers has advanced practice. So I couldn't do what she does as far as writing prescriptions and counseling because I'm not in mental health. But every level has its scope of practice. But as long as you are out in the everyday world and you do what you can do, as long as you don't pass that scope of practice, like I couldn't do a tracheotomy, like those emergency ones. I can't do that, right? But if I can help, like they helped you, getting you positioned so you didn't hit your head when you fell, making sure you had the orange juice, and I'm sure there was sugar in the orange juice, things like that. That's within our scope of practice. And the Good Samaritan law covers you so that you can't be sued as
Yeah.
long as you're doing things within good faith, not maliciously trying to hurt somebody, but save them, you should be covered by that Good Samaritan law.
Okay. So, with this going on, what you're doing, how can this training help someone begin a healthcare career quickly?
Well, it's a 4 week program, like I said. We do 2 weeks in class, and then we do 2 days of CPR, like Dr. Wright said. It's part of the program. Our program is set up so that there is nothing that they need to not complete this program. We have the textbooks, we have their uniform for clinical, we have their supply kits, the blood pressure cuff, the gait belt, all the little tools that they need in the working environment. Plus, they get their CPR into the program. And we also pay for the state exam because at the end of it, there's a state exam that they have to take to actually be certified. They complete the program, but they're not certified yet through the state. So our program is all inclusive. Plus, they always have access to me. I had a graduate, that one of the little graduates, that just called me because she was having an issue with her first day of work. And I gave her some advice of what to do and who to go and follow chain of command, what she learned in the classroom. And so it's the quickest way to get in. You're actually, in the second part of it, we're going out to clinical sites where you're actually, what you learned in class, you're actually working with patients, live patients, not pictures in a book anymore. And you're going to start to see some of the disease process that we talked about, some of the communication issues that we talked about, some of the behaviors that we talked about in the classroom, with the dementia and Alzheimer patients. So they're going to get a real live experience before they even graduate. And that helps them understand, like, do I want to work in this environment, or do I want to work in another environment? Because they're introduced to other interdisciplinary team members, meaning the occupational therapy, the physical therapy, the respiratory. So they get to meet all these people, dietary, things like that. And they get to see, like, oh, maybe that interests me. So it's an opening to a different world of healthcare, and not just particularly nursing. It could be something that might pique their interest. One of the students actually is looking at going into physical therapy because she really enjoyed that part of the clinical training.
Mhm.
So it's just a stepping stone, if you want to call it anything other than that.
So
And
I'm looking at. Oh, go ahead, Doctor Wright.
yeah, I was gonna say yes, Miss Angie really hit the nail on the head on the fact that it exposes them to different areas. Healthcare for a lot of people can be overwhelming. Oh my God, where do I start? How do I go? This is an entry level. It gives you the opportunity from a easy standpoint, not the pressure standpoint, easy standpoint of, do I really like this? Where do I want to advance to? So say for example, in the CNA program, a lot of people thinking, oh, I'm just going to be stuck with old people. No, that's not how it is. You
No.
can be in a hospital setting as what they call them patient care assistants, right? You can, when you're done, go into the hospital, you're working with patients. You can finish, be in the group homes, nursing homes, or just maybe as a caregiver that is skilled with advanced at least training than just someone who's home with grandma, right? And so those are the different areas people can go, and it gives reassurance to the care receiver, or the family members, to know that these people have received a certain level of training that gives them exceptional ability to care for this person. So it really opens a lot of doors for those who are looking into the healthcare field, or just want to be a little bit more knowledgeable about the care for their loved ones or those that they care for.
I was going to say that when you mentioned they go out to the centers and do that, there's nothing no better than having real life experience doing that. Because you behind a text, see, this is what we call, when I went to school for computers, Microsoft certification, all that stuff, we got a thing we call people a paper cert, where they could take a test, they could pass it, but out there doing it is different. I'm gonna be honest, they can't do it. But as long as they behind the desk, they could do that. But as soon as you put them out there in the real world, they stumble, they fall, and they panic and all that. So what you're doing, I think it's great for them to get out there and see exactly how everything works and everything goes on. And do you have, how can I put it, the stomach for it? Because
Yes.
it's some things that going out there that the average person cannot do or will not do because, oh, I don't have the stomach for that. So
Yes.
so when you get out there and you see things that you don't see. So how do you talk to your students about that? It's going to be some things that you're going to see that may be upsetting to you.
Yeah.
They will see some things like, wow, I didn't know all this and all that. So how do you talk to students about that?
Well, a lot of it is my own personal life experience. I've been a nurse for 29 years, and I worked in long term care. That was my first job out of nursing school. I did that for, oh gosh, a good 9 years altogether. I did hospice as well. And I did let them know that even though the people that they're going to take care of during their clinical rotation are living in a facility, they can be hospice patients as well because that's their home. So we talk about all those different things that they may see. They may be seeing someone that is transitioning, passing, they may see someone that has a big, ugly wound. And we talk about those things. And the way I talk about it is from my personal experience. because where we go to clinical, one of them is where I work on the weekend. So I'm very familiar with all the residents. So I know who they can approach and who is more apt to letting the patients, students work with them. But when they ask me questions and they're interested in like that wound care patient that I have, I will let them know and I go show them and I tell them this is what we're doing and this is how we're trying to heal it. And so they're more familiar with like not be shocked if they're not going to see it as they move out of this clinical rotation and into working. Some of it is the behaviors, and I'll explain to them, I had a patient that X, Y, and Z, and this is how we manage that behavior. So a lot of it is like me bringing my life experience into the classroom. And then when we're at the clinical site, telling them this patient does this, this, and this is how we're going to manage it. And this is what the patient will let you do for them, to the extent of they don't want a student or they love students. It just varies. But my 29 years of nursing has a lot to do with what we talk about in the classroom to prepare them for the clinical. And then when we get to the clinical, because like I said, it's where I work on the weekends, I'm very familiar with the residents and their temperaments. So that helps a lot too.
See, my son is in the medical field. He started off working in the emergency room, and
I
then
love the
and then he turned around and got into this coding. I said, "What you talking about coding?" He got in that, learned how to do all the codes and everything, and he loves that. So he moved on to that right there. But he did tell me that is one thing when you went in there, and there are a couple of people that do this. They get attached to the patient.
yeah.
And he said, Dad, that's the worst thing you could do because once that person transition out, personally, it affects them personally.
Yeah.
So how do you talk to the students about being attached or don't get attached?
It's not it's not anything that you can control, unfortunately. I've been over the years attached to many patients, and I do tell this story to the students in class. I had one patient, his name was Charlie, and he came to my facility, and nobody ever came to see him, and he came because he had end stage cancer, and he was very shut down when he came to us. But every day I would go in and give him a big smile and come on, Charlie, let's get up and try to motivate him. And little by little, he started opening up to me, because I was a consistent person trying to be nice to him, trying to get him motivated. And as he got worse, he started shutting down again. But as he got closer, and I know he got closer, I worked Monday through Friday and I left on a Friday. And before I left, I always said goodbye to him. And I said, okay, Charlie, if you need me and they need to call me, let them know to call me. I will come whatever time you need me to come. And he's like, oh, no, honey, that's okay. I'll be back on, you'll be back on Monday. And I said, he goes, but I'm tired. And I said, Charlie, and it's not that permission of letting them transition because he had no family that would come. I guess I became that for him. And I said, Charlie, if you need to go, it's okay. You're tired. It's okay. You can go. And he's like, thank you. And then when I came back on Monday, they're like, oh my God, he's been so horrible all weekend. He's just like in a lot of pain. And I went in there and I said, I smiled. He goes, there's that smile that I've been waiting for. And I said, I'm sorry. You should have called me. He's like, I didn't want them to disturb you. I knew you were coming back. So he like, I'm tired. I'm tired. I said, it's okay, Charlie, you can go. And within a few hours, he passed away. And that I will never forget that. So you can't not get attached to your patients, even the ones that drive you crazy because their behaviors are repetitive because of dementia.
Yeah.
But you know that it's not them; it's the disease process. So that's what I talk about in the classroom. I give them those kind of life stories so they prepare because you know you're gonna love them no matter what.
Yeah.
It's not gonna go away. I have a 104-year-old little lady right now that I adore her. If I could take her home, I would. She's alert and oriented. And I go in and I see her every morning, when I go on the weekends, and she smiles and she's like, hi, and she's talking to me in Spanish and she's waiting for me. So you're not going to not get attached. And the girls got to meet my little 104-year-old lady and they're like, oh, she's so cute. And I was like, right, you can't not love her, but you can't. It's human nature, Ron,
Yeah.
to you. I would be afraid of someone that didn't get attached at all.
Hmm.
That would be my fear. And I don't know, Dr. Wright, psychologically, that would be something that it's not natural to not get attached to people that you're caring for because our nature of nurses is to care for people, not only physically, but the emotional comes along with it. Because sometimes you just have to go in and pat their hand and sit there with them. You don't even do nursing, so to speak. It's just being another human being to another human being. So you can't not teach them not to care
Okay.
or get attached. If that makes any sense.
Yeah. Dr. Wright, you want to chime in on that?
Sorry, I was muted. But yes, I mean, every field in nursing, I tell you, because you go first with your heart before you go with your skills. Because if you go with the skills and the heart is not there, it's not nursing. It's not. The heart has to be there. And once the heart is involved, that's it. You have no way out but to basically be there 110. So that personal attachment part, it just takes a level of understanding to say, okay, this is what I have to do, but I am still looking at this person from a human perspective, right?
Mhm.
And as you were providing that service, you're looking at them, like Miss Angie said, you now understand you're no longer just a caregiver. You are now a part of this person's life. You are part of their family, so to say. And imagine her telling that person to say, you know what? It's okay. And finally him saying, okay, you know what? Someone is telling me I've done well here. So it's a very, I don't know how to put it, but I mean, you can imagine those who lose whatever, a pen or whatever, that favorite thing they like, and then all of a sudden, so imagine a human, right? So the heart is the first part, and I always tell people, even in my field, nobody cares what you know if they know you don't care. So you have to care first of all. If you don't show them you care, they don't care what you know. Nobody cares what you know. So the skills come secondary. The heart is the first part. And that's what we try to, because anybody can, there are several courses for CNAs anywhere and everywhere, but we put that heart part to it, and we help you understand it is not just those skills. It goes beyond that.
That's why I say they call it
Absolutely.
health care because you have to care. I
Yes.
like how you put that. That was good. So, somebody just texted me and asking, what does it cost to join this program?
So the total tuition is 1240, but our first summer class that's going on May the 11th, we're offering a discount of they get their textbook, the supplies, and their uniform discounted from their tuition. So it comes out to 1104, I believe.
Okay. Okay. So, what makes your training program different from anybody else's?
I think a lot of it has to do with I love love to teach. I do it even when I'm not teaching. My fellow coworkers, when they ask me things, one of them calls me boss. I need this. I'm like, I'm not your boss. I'm just a supervisor. But they're always asking questions, and they're some of them are fellow RNs, but I've been a nurse so much longer than them that my experience, they like, she's got to know. And I may know or I may not know. Sometimes we have to Google things together. I'm not a walking encyclopedia of nursing like my mom believes that I am. But, it's just as long as I can help somebody understand something better, that's what I love doing. And as far as my students, I get great joy out of their success when they get that, like, oh my God, I can do this, or oh my God, I learned this and I'm doing it. That brings me joy. And the enthusiasm, I think, for teaching, they can feel it, and that's what makes our class. It's not just robotic, like I'm going to class, what am I learning, let's go. It's like I try to impart why we're doing what we're doing as far as helping fellow human beings, whether it's going to be in the hospital like Dr. Wright said, or in long-term care or home health, wherever you're going to encounter your patient. I think that my program is different because we have that passion for it. And again, some of the other little extra things that I'm teaching them besides bathing, dressing, changing, that kind of feeding, those are very basic skills, but we have so much more in it. And we have a lot of fun. We have a lot of fun in the classroom.
Yeah, when you said your experience in there, that means a lot because you could tell them something you experienced this, and a lot of people want to hear that, and it's just like, how can I put it? You can't go to somebody and talk about marriage and they never been married.
Well,
you know?
that part
Yes.
too. That part too.
Yes.
Now, I was gonna say one part about when you talked about the listener who was asking about tuition. I know for a lot of people, 1100 might be like, oh my goodness, that's a mountain of funds that I have to come up with. And I would like to use this opportunity to also reinforce to our community here in San Antonio. One of the greatest things that we've been trying to do is partner with, say, Project Quest, Ready to Work Essay, and some other organizations that are offering assistance to students. We realize the importance and benefits of this program. It's not that we don't. We get people who come through who are wanting to be, registered because they want to get help. We're talking about mothers who are looking for ways to support their family. We're talking about students who are looking for ways to make some money and not just be out of funds every time. We're talking about people who are losing their jobs and saying, "Hey, what is another way for me to?" And these are, like we said, entry level that is at least double the base pay right now, right out of graduation. And so these opportunities are there. Ready to Work Essay, Project Quest. We, I think, have a meeting scheduled with Project Quest at the clinic, at the
On
campus.
Monday. On
Yes.
Monday.
So we
Yes.
have that coming up. And then we are looking forward to working with the Ready to Work because these are organizations which we're open to any others. We have sororities who are looking to support because you would have people who are in need. We have churches. We actually have one of our recent graduates was part of a church affiliate. We have churches, we have different organizations who are saying, hey, we have people that were funding every time, giving money. They say, teach a man to fish, right? You feed him for life rather than just giving him that fish every time. These are what ways that people can get into the workforce. And the healthcare, as we know, is one of the most reliable ways to definitely get yourself going as a source of reliable source of income. And so we're putting it out there. It's in the works. Ready to Work Essay, Project Quest, and then any other organization, sororities, churches, religious organizations, different work environments. If you have cleaners, janitors, whatever, we work with one of the facilities here in our community who literally took their staff members and said, you know what, let's move you up, right? Rather than you've been here for like forever years and you're still in this, one position that is barely meeting the ends for you. Let's help you.
Hmm.
We can bring them on. We can do that. So those are all of the opportunities that we have available when it comes to helping students. But when it comes to the tuition, let us know. Give us a call. There's financial aid assistance that we provide. There's tuition support. Even if we have organizations that want to say, hey, you know what? I'm willing to support someone. Let me know. We have them available. Would be more than happy to entertain that.
Oh, that's good.
Mhm.
It was one outfit that somebody told me that they worked with, and I was surprised that they helped them out. It was Alamo Workforce Solution. That's another outfit that helps out and stuff like that. I love what you're doing, reaching out to the community and reaching out to everybody else and let everybody know we're here for you. So, my next question: what do you hope students take away from this summer program experience?
I think that a lot of it is like rolling back to what we talked about, not being so busy, not noticing other people. I think that I would hope that they take away the love of caring for a fellow human being, you know, being aware of other people's situation as far as, like I said, the signs and symptoms, being more alert, learning to advocate for their patients and for themselves, because sometimes, they're brand new and they get the worst section or whatever, and I do teach them advocate for yourself, understand what your responsibilities are, but understand what your rights are as an employee and what your patient's rights are. So I think it's just getting a better understanding of, you know, how to help these patients and how to help themselves and how to just be a better human being, because it's very humbling to go into this work environment at this level as a CNA and to bathe someone and to change their briefs and to feed them and and to sit there and talk with them when nobody comes to visit them. So it's a very humbling experience. I myself was a CNA for 2 years before I got my LVNs, before I got my RNs. So I understand every level it takes to get to where to get my master's. I was in all of those classes. So I have that experience to say, hey, this is your next step, and this is what it takes to be that, and such, you know. So just that, and to be able to know that Pinnacle Career Center is always there for them, even after they graduate.
Okay. So that's enough of the questions. Now I want to get down to let everybody know exactly about the program. There's always behind the scenes things that you do to put this together. That's what with almost all businesses that's going on. So what were some of the challenges that you met putting this program together?
Just getting the because I had already been a dean at 3 different nursing schools in San Antonio. 2 of them already had a CNA program, so putting the program together wasn't a challenge in it of itself. My master's is in nursing education, meaning curriculum building and things like that. So that wasn't the hard part. It was just and even clinical affiliation where we get to actually go and work with these patients. I've been in this community for 15 years of nursing education, so all I had to do was call my Rolodex, technically not a Rolodex anymore, but your phone, you know, and call up my old partners in the community. And, you know, they were willing to, yeah, when are you coming? It's like, well, we're just putting it together. But, you know, we really didn't have difficulty, I don't say on my part, as far as putting it together. Um, Getting some of the things for the classroom, like the tables and things like that, that took a little time to get the right amount of supplies and equipment that we need. But I didn't find it super challenging on my end. I don't know, Dr. Wright, on your financial end, where where you would say about that.
So, I mean, life comes with challenges. That's the one constant, right? If you have a smooth sailing, never ups or downs, there might be some issue you're not aware of. However, the thing that gives me joy is like Miss Angie talked about, we just had our first cohort graduate. I mean, that is, no matter what you do in your life, you have impacted people for generations right there. You have set them on a course. We put our motto as Together, Forging Your Path at Pinnacle Career Center. It's called Together, Forging Your Path. And we put it that way because we realize we're only at the basics. We're only at the scratch level. We know there's more to achieve. And I remember the first day of class, we were talking and I was sharing with the students. I said, listen, never doubt yourself. Never, underestimate yourself. The challenges will come. We had, oh my God, Miss Angie, how long did it take us to forever get the whole program and everything finalized? It took us so long, but we were able to pull it through. We're working right now on our medication aid assistant program. We're reviewing the one for the phlebotomy class. We're working on, so there's several in the pipeline that we're working on and coming through on. And by the way, for those who are at least LVN degrees, that's a licensed vocational nursing degree and higher, we are hiring because we're anticipating growth. And as we're growing, we want to bring on more competent, compassionate people to share their life experience, to share their skills with the students that we have at the campus. And so challenges come, but that is it. What doesn't kill you make you stronger. And here we are getting bigger and
Yes,
better. So that's what we're doing.
yeah,
Well, I like that. I like that
yes,
what you just said. It makes you bigger and stronger. And going back with me, I self-taught myself everything what I'm doing right now. But I did research, and that's the key right there, doing research. And me being a blue collar person working on computers, working on wash machines and all that stuff, you have to learn how to troubleshoot. And that's what society lacks right now. They think you get a part and put it in. If it don't work, oh well. That's how they go. But you got to troubleshoot, which is basically what you're doing. You're bringing students in, and the troubleshoot is already done because you got somebody that been doing this work for over 20 something years, so they know the ins and outs, and that's a good thing. That's almost better than life experience. That somebody tell you, hey, when this happens, this is usually the symptom. You know, not all the time, but at least it will lead you to it.
right.
And my hat is off for y'all doing this. Oh, my question is this: is the May 10th your only summer class, or are there other class down the line?
No, May the 11th is the start, and it's 4 weeks. So the next one after that will be in June. I think it's going to be June the 6th or 13th. I'll have to look at the calendar. But
Okay.
we run every 4 weeks. There's 4 weeks of the class, and then there's a week in between so that I can get grades and things like that in following the Texas workforce. You got to put everything where if they come and see, they want to see it.
Right.
So there's a week in between. So typically every 5 weeks, a new class will start.
Oh, okay. So, how do students know about coming in for the class? How do you go about recruiting students?
So we have a great presence on various social media um, avenues. And again, our website is www.pinnaclecareercenter.com. That explains all the program. You get to meet, tells us about us, our experience, and then it also tells you about the other classes that we have coming down the pipeline. And some of the requirements, our catalog is on the website, so they can read what are the responsibilities as a student, what are the responsibilities as us as a school and the administration, and then the requirements, meaning the immunizations that they're going to need, the GED or high school diploma, like the documentation that they'll need to be able to get into our class. And those are things that are not, the immunizations are not Texas workforce, but there are clinical providers, our
Mhm.
partners that require these things, right? Um, Texas Workforce requires, and the Department of Human Services, who is our main regulator, requires that they have a GED at least, right? Um, it used to be 18 years old, but now you can get a GED at 17 and under. So
Right.
those are some of the rules, and you'll see them in the book and how the program is lined up, what you're going to learn, because it tells you about the program, it describes it, what the expectations are, the actual setup of how the units and what you're going to learn in each unit. So there's a lot of information on the website. So I would really recommend that people go to the website if they really want to learn every little nitty gritty before they come. And then also, obviously, they can call the campus. Our number is 210-982-6520. And I have that phone literally with me all the time. So they can call and set up an appointment to come to the campus, talk with me, because that's part of it, the interview, look around our little campus. And we are little right now, but we are expanding upstairs. So very happy about that. So yeah, just to come and see and just get a person one-on-one talk with me, and let's see where they're at, and is this something they want to do, and how we can help them start that process.
So, my question to you is, what can we do? What can WSN Radio do to help you out to get the word out?
I would just put our website up there, invite people to go to our different social medias, look for us on social media, and just spread the word, hand mouth to mouth. A lot of people in the community, if they want to get in touch with us for just what you're doing, invite us onto their platforms and let us talk about it, and spread the word that way. I know once we start rolling, word of mouth with our students is going to grow. And even actually being in an environment at my law facility, when I had my students there, one of the people from housekeeping said, "I didn't know you did this. How can I go?" So even that, being out in the community physically, is going to help as well, to help us grow and get more
I, I,
people out in healthcare, and start their journey to wherever it is that they want to go in their life. It may
yeah.
not be healthcare, it may be something else, but this might be something that opens that door for them.
I would like for y'all to come back on after your May graduation is over with to let the viewers know how many you had and all that good stuff, just to keep it out there, let everybody know what's going on all the time. Because
Absolutely.
San Antonio is a unique city. I'm gonna use the word unique. The reason why
Yes.
I'm
It's the
saying
next melting pot. Melting
yes,
pot. Yeah.
because you almost have to feed them the information, and that's what we're going to do. We're going to feed them the information. Hey, if you sitting around after high school, you don't know where to go, well, I could tell you a course you could take that would lead you into your
And
career.
And that's great because you mentioned that one of our biggest focus now is trying to make sure we're connecting ourselves with high schools. If they especially are having a lot of graduation coming up. This is May approaching. A lot of high
Hmm.
school graduates are getting out there. They have at least till August before they go to school. A lot of them still have to figure out tuition, boarding, feeding, clothing, and all of textbooks and everything. Yes, there might be some financial aid they can obtain, but how about they are able to, on their own, make a little bit of money that they can use for themselves, not just by waiting for mommy, daddy, or anything else to come through. That it's a 4 weeks course, 4 weeks. You're in, you gain all the skills, you get your certification, bam, you're earning at least double the minimum wage, right? So we're calling out high school organizations, we're calling out community organizations, we're calling out sororities, we're calling out religious organizations, we're calling out different groups that help out people. It is never enough to give out the fish. It's about time to teach them to fish. So
Hmm.
think about it. By the time you feed these people for another 3, 4, 5 months, the minimum, because no household can survive on less than $200 a month. I know that for sure. Less, it's impossible. Just going to pump your gas these days will almost cost you
Yeah.
$200.
Yes.
You know, so
Especially
even
right
if
now, yes.
yeah. So by the time you think of the minimum 4 to 5 months that you fed these people, you can put them through a training that will feed them for a lifetime, right?
Mm,
And so
yes.
we're saying organizations, churches, schools, sororities, any organization or community organization or entity, or even government bodies that work with the community, that help to support, that finance, that provide, reach out. We have different programs. If they're coming from such organizations, there are special rates that we offer for those. So it's not going to be the typical, but if it's just on an individual basis, we also work with them. So there are different opportunities. Ms. Angie mentioned the phone number, our website, www.pinnaclecareercenter.com. And the phone number, she's always with that. Once again, the phone number, Miss Angie.
210-982-6520. If you want to sponsor somebody, whether you're a community organization or even just an individual, like you can have that you want to sponsor somebody, be a part of this growing effort to get more people out in our environment. We are a military-based city. Unique is quite a
Hmm.
word, so it is a lot of different cultures, but that also means that we have more and more people coming into our community that were not San Antonians to begin with and that have
Right.
decided to stay because they like it. So we're constantly growing. So we need to put out as many healthcare people into our hospitals, long-term care, home health, and such. So if you want to individually sponsor a student, that would be great. Even if it's a partial sponsorship, we're always open to, that to facilities or community bases. Anybody, if you want to become a partner with us, let us know, and we'll definitely on our webpage advertise and on our put you part of our advertising. So we're putting you out there as well as you helping us.
Well, if you have any literature or anything, flyers, please send it to me so I get it out there and talk about my morning show and all that good stuff. And we even put a commercial together for you, of what's
Okay.
coming up. We could do that. Anything to get the word out because I'm all about community. I mean, my wife said something to me the other day. Said you are I'm busy more now than when I was working. I'm retired,
Yes.
but I'm busy more now than anything else because I have a passion to getting the word out and getting the word out for resources out there. It's so difficult sometimes. People don't know what's going on. Like your class is going on. I did not know about it. So Dr. Wright send something to me,
Mhm.
and that's what the people need to hear what's going on. Cause like you said, teach them how to fish, and resources. It's almost like that. Teach them where the
Mhm.
resources at, learn off that, and cultivate what you're doing.
Mhm.
And I see your program. I already know it's going a long ways anyway. I already see it. It's
Thank
going to
you.
be out there. You're going to have a campus of over 200 students. I'm just preaching it right now.
We're
But
going to need a bigger campus. We may have to
yes,
move.
but when that day happens, you look back how you started. A lot of people are focused on that big revenue.
Mhm.
Well, I won't be a millionaire by the time I'm 30. Well, you're 29. How you gonna do that? You know what I mean? I mean,
True.
money is good, but it's not everything.
You
Mhm.
don't
You
take it
know?
with you. So, yeah.
Yeah, yeah. So I always tell everybody that. I say I'm not in this for the money. But if money come my way, don't get me wrong, I'm gonna take it But I'm
Yeah.
not in it for that. I'm in for what y'all doing out there to teach people a career. Because, back in the days when we worked with somebody, with a company, we stayed with that company for life.
Mm.
It's not
Yeah.
like that anymore nowadays. They job hop, trying to
Yep.
find the best place to be at, trying to find
Hmm.
the best fit. Sometimes your butt need to stay still in that place that you at, and you will grow with that company. If they see your potential, you will grow with that company, and that's part of the problem. But what you're doing right now, you have a stepping stone for them to get into
Hmm.
healthcare. And I
Hmm.
think I think that is
Hmm.
brilliant. The 4 week course, I bet that course is so rigorous and just boom,
Well,
boom, 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 boom.
it's a lot of learning in the short term. And I thought it was a lot, but we actually asked the students um, that Dr. Wright came in and talked to the students in between a break and asked them, if it was too much or what were they learning. They're like, no, they were not overwhelmed, which is like, I wasn't sure because it's a lot of information because again, it's not just bathing, changing, things like that. So no, they did really well. The valedictorian had a 95 point something GPA. The
Wow.
salutatorian had a 91, and even our honor roll had an 86%. So like they got the grade, so it's not overwhelming where they're just barely passing with the 75. So they did really, really well. So I'm proud of the program. I'm happy with the program. It's something that, like I said, I love doing. But you're right about what you said about staying one place. When I first started teaching, I was just a clinical teacher, and then I went with Alamo Community Colleges, and I stayed with them for a year. And then Kaplan offered me a job, and again, I just came in teaching. And I would not have thought when I got that job at Kaplan that 4 years later I would be the dean of the program. I would not
Hmm.
have, if you had asked me, I would have said, no, not
Yeah.
me, because I didn't see that for me. But Kaplan saw that for me. The job saw that for me. My executive director saw that for me. So you're right. Sticking around because somebody sees potential in you, that's a big part of, building a career, not just I have a job, a profession, and I'm hopping, 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 you know.
Yeah. And that's sort of bad job how people look at your resume. You had 13
Yes.
jobs in 10 years? Just saying that. All right. In closing, what would each one of you like to say about the program?
Dr. Wright?
Oh, what would I like to say about the program? I would like to say Pinnacle Career Center. I mean, for me, I've always loved teaching as well. So this is not just your everyday going, crashing, get out kind of program. No. Like Miss Angie said, we put our heart to it, and we are definitely making this an avenue for anyone in the community, organizations, or whoever to support their own and help the community grow. As you said, it's a unique community, it's growing rapidly. They just shared some data recently that I was looking at about what is coming up in San Antonio. And I just think right now it's a great way for people to learn, to grow, and set themselves up before it just blows up before they catch it. So come on, Pinnacle Career Center. We're more than happy. Check out our website, www.pinnaclecareercenter.com. We're more than happy. And come visit the campus. Come see us.
Yes. So to piggyback on that, we're all about passion for helping our community be better. And for me personally, it's my goal is to put out the best. In every business you have product, and our students are our product. And I want to put out the best product in the community, knowing that I wake up one day and I see the face of a student, I'm happy because I know what that person knows because I taught that person, and they're going to do the best to advocate for myself as a patient now instead of their teacher, and just to know that we support them throughout their whole career, however far high up the ladder they go. I have students that have surpassed me, even when I taught them as LVNs. They have their own nurse practitioner program going on, clinics and things like that. But they still reach out to me, Miss Garza, I did this. Miss Garza, I've done this. So I'm very happy about that. And I want them to know that just as excited as I am for my past graduate students, I will be for them, and I will be there as a resource. Give me a call. Pinnacle Career is always going to be here for you. And whatever you need us to be, even after the fact, we will not let you go just because you graduated.
Okay.
your
Well,
family.
yep. That's a good one. All right. I appreciate y'all taking time out of your busy schedule to come in and talk to you about your program coming up. That means a lot. And we got listeners out there, and hopefully they will come call you, sign up, or whatever they need to do. But I do appreciate y'all taking time out coming on the show today.
Thank you for inviting us, and thank
Thank
you for
you
giving
so
us
much.
this
We
time.
appreciate it.
Yes. And we'll talk to you down the line. So take care.
After
Thank
our
you
May class,
again.
for sure.
Yes, definitely that. Okay.
All
Thank
All right.
righty.
you.
All right. Take
Have a
Bye.
good
care.
one.
Okay.
You
Bye.
too.
All
Bye
right.
bye.
Thank you for tuning in to WSAN Radio. Catch us on our YouTube channel, WSAN Radio SA. Subscribe to our channel and hit that notification button.